Dr. Randall, the Soul Doctor, author of Soul Doctoring, Heal Yourself, Heal the Planet, shares her 40 years of experience as a cross-cultural practitioner, medical futurist, and expert in 20 different modalities of healing, along with amazing interviews with some of the leading minds in medicine and big thinkers in all walks of life. The stories of our lives are the woven energies of our soul's paths. They feed and ignite the spiritual light that nourishes the universal soul, the one mind, the cosmic consciousness where we all come together. This podcast is going to be a deep dive into the personal stories of people who have made significant contributions to the planet. What formed them? What moved them to become these leaders and innovators that inspire us so? Hi, Bruce.
Hi, how are you?
I'm good. I'm happy to have Dr. Bruce Sadalik on the show today. And he's very talented. He's a naturopath. He has done many things. He seems to be quite proficient at working with government organizations, and he actually is the chairman of the medical board for the state of Arizona. And he also works with the naturopathic board in the medical examiner position, and he also works with the board of medical examiners. Is that in traditional medicine too, or just naturopathy?
It's the naturopathic medical board, correct?
Great. So he went to school at Southwest College in Tempe, Arizona, and he did his internship through the University Medical Center. That's the one in Tucson where Andrew Weil is?
Correct.
Right. Did you get to work with him at all there?
I did. And I got to work with some of the faculty too.
Mm-hmm. I worked with him when I was there. Yeah. He's quite a guy. I like him for his iconic work that he's done, in terms of, I think he broke the glass ceiling first, maybe, there were others of us that were doing it, but he broke through and led the way, I think.
He did. Yeah, he was definitely a pioneer there.
Yeah. Another interesting thing about Bruce is that he's worked in the emergency room, actually flown AirVac, and, he was way into that, and also worked in pharmacology, through his association with the emergency room. He's taught students. You still teach students, right? They come to your office and do their practicums, and
I do. I do get a lot of mid-level, and which would be nurse practitioners, physician assistants, and then medical students. Mm-hmm. And I do get some people that are doing their residencies in family practice that come through for part of their rotation. Mm-hmm. So
go ahead.
I try to spread the, knowledge of integration as much as I possibly can.
That's great. So they come to you for their integrative medicine experience, I understand.
Correct.
That's great. And so, of course, we need that. I mean, I was on NBC years ago saying this is the medicine in the future. And now I look around and I go, hey, guess what? We're in the future. It's happening. So
progressed. That's true.
Yeah. And so do you still love it, teaching?
I do. It's nice to see somebody that comes in really unfamiliar with any of the integrative modalities leave and be able to start thinking outside the box and perhaps combining different pharmacologies along with some of the integrative medical portions.
Yeah, it's great. I still love teaching. I have students that come to my office too. I don't ever get tired of that. It's great. So, Bruce is also special in that he got Physician of the Year in 2005. That's not an easy thing to get. He must have. And he also got the Southwest College of Naturopathic Medicine Legacy Award for the work that he did in, I believe it was emergency medicine and pharmacology. Is that correct?
Correct. The teaching of those. I did teach there for a while.
Mm-hmm. That's awesome. And the governor appointed him to be on the medical board, as we referred to earlier. So he's a big chief up there. He loves to integrate modalities in working with his patients, and it seems as though in terms of teaching and making people more aware of integrative medicine in general. He's been on PBS as a guest speaker for integrative health care and medicine. He's been on ABC for similar subjects. He's a regular guest speaker at the Tucson Medical Center. And is that to students and faculty alike, or?
Those are mostly to the, they have various support groups that they run, or they were doing prior to COVID. So there were support groups that were in different areas, like, for example, muscular dystrophy and various other etiologies that I would try to guest lecture on to the support groups.
Oh, that's great. So you would tell them integrative ways to handle special conditions.
Exactly.
Wonderful. Wonderful. So he also did interviews for KNST radio. A couple of them were hormone replacement therapies, cardiovascular health, and that was conducted by Southwest Cardiology. He did a lecture for long haul COVID, basically. Now, where was that?
That was long haul COVID. We did through a podcast.
Mm-hmm.
Actually, it's believe it's on one of the internet sites. I have to look.
Mm-hmm.
The debilitating fatigue, similar to chronic fatigue syndrome from the long haul of COVID, people who have obviously trying to recuperate from it.
Yeah, I've seen that. I want to get back to that with you. So let me finish this, though. And he's also done a number of programs for the Pima County Health Department. And I love these titles because it tells me where his head's at. On affordable geriatrics, fire in the belly, which is, of course, all about gut syndromes, especially it seems like inflammatory ones, valley fever, healthy diet for your child, the art of aging, and integrative pain management. All great subjects, Bruce. So let's dig in. That's fabulous. You got a lot to draw on there. So Bruce, tell me, let's start with a regular week. How about Monday, like today? How do you start your day, or does it vary?
The day varies. We typically, we try to keep the schedule workable, i.e. we try not to do every 15-minute type appointments because that can be not beneficial for either party. So
how long are your appointments?
They tend to be about 30 to 40 minutes, 45, to get the complete history, pharmaceuticals, botanicals, nutraceuticals that they may be taking currently, and then what the diagnosis is and or what they think is currently going on with them physically.
Mm-hmm.
And also the psychological portion. What's the stress level like? What's the home situation like? What's the work environment like?
Mm-hmm.
Typically about 40 to 45 minutes.
Yeah, I agree. I take like an hour, but it's so much about mental health now, especially with COVID. But, I'm sure what you're saying, because I do it too, is it's really important to know where they're coming from, what they think. And a lot of times you hear more in between the words than actually with the words.
Exactly. And body language, all those things, as you well know, are critical.
What's the most common thing you see?
The most common would probably be either hypothyroidism or autoimmune etiologies, and then chronicity of pain. So those might be the three most common.
Wow, interesting. Is the hypothyroidism also autoimmune? Is it Hashimoto's or is it?
At times it's Hashimoto's, and at times it's, as we well know, those labs sit in that indolent level where they push the needle, but they're not quite over the threshold yet. Mm-hmm. So I kind of look at it as that might be a storm on the horizon. So how can we kind of cool the system down and at the same time not over-medicate with thyroid medication, but utilize medication if needed, depends on how hypothyroid they are, and then also work in the background to reduce some of the inflammatory syndromes that may be causing them to wind up with Hashimoto's thyroiditis.
Exactly, like curcumin or something like that, or
exactly curcumin, some of the boswellas. As you well know, essential fatty acids can be just phenomenal on cooling some of this heat down.
Awesome. So are you known as sort of a thyroid guy, or?
It's not one thing I'll totally look for in practice, but for some reason it does tend to come in to the office more.
Makes me wonder about the iodine levels in Arizona,
Yeah. Well, and at times.
Well, you're not very near the ocean, so I guess you don't get much seaweed and stuff.
No, we don't have that nice ocean. That's for sure.
Yeah. So you spend every day in the office?
I'm in the office usually Mondays administrative, and then Tuesday through Friday tend to be our office days.
I know the schedule's been kind of odd for all of us during the COVID, but let's say before COVID, how much of your time was spent outside doing lectures and other work for these boards and whatnot?
Yeah, prior to COVID, it most likely was take an average week, probably about 5-6 hours outside the average week doing other duties such as either teaching or working with the state boards. It was probably about 5 hours a week.
What's your favorite thing to do, like in terms of your patients? I mean,
favorite thing to do is to see the progression of somebody who comes in and is integrative or any type of medical ideas are totally, brand new, and then see the turnaround with somebody.
Yeah.
Or be able to lock down that diagnosis that for some reason may have gotten skipped over.
Awesome. You were saying you gave a lecture on long haul COVID. So what are some of your tricks of the trade for that? Because I've seen that too as a toughie.
It is a toughie. What I tend to do is I'll look, obviously they've had it, we know from laboratory serologies, but then I'll check for other labs that may have.
I'm sorry, just explain to my guests, because they don't really know, what will you see in the blood?
So for example, with COVID, you'll have IgG post, meaning that they've had it. And then I look for, do they have post residual volumes of Epstein-Barr? Do they have other things that can cause chronicity of fatigue? And then try to come up with they're all viral, obviously, but then try to come up with a plausible method to treat the fatigue, and then to also help the immune system get over the chronicity of fatigue, i.e. whether it be COVID or chronic fatigue syndrome.
Can you share some of that with us? What that would look like?
Sure. So what you want to do is some of the intravenous protocols are really helpful. Glutathione intravenously can very well help, and with the mitochondrial function. Vitamin C intravenous. Linus Pauling was the main guy decades ago. Can be helpful for slightly lowering viral threshold. Adrenal function. A lot of those, whether it be chronic fatigue syndrome or whether it be COVID, a lot of those just really wipe out our adrenal function. So I look at what can we do, either nutraceutically, botanically, or perhaps with just a micro dose of a hydrocortisone along with a nutraceutical botanical to help bring that volume back up.
Makes me wonder, if maybe that's why they got it, in the first place. Maybe they had a little EBV going on, or maybe adrenal.
Yeah, I agree. Or they had, some people come in with a 8 to 9 or 10 level of vitamin D. So they had really low D. Yeah, so I think it's a perfect sequela of things that happened.
Yeah, that's the number one thing, is the low vitamin D. 90% of people admitted to the hospital had low vitamin D levels, or were obese,
Yes. Yep. Yeah.
So what's your favorite way to help people lose weight? Because that's a big thing right now.
Yeah. And it's somewhat controversial. You have, various, tons and tons of various diets. I like kind of a modified, best way to put it is a modified ketogenic / modified paleo combination. So something that is the biggest thing, as you well know, is to meet them where they are. So for example, if they're back at work, what are they willing to bring to work, or what are they willing to get at work, or how can you make the diet work for the person? Because what we may recommend may not be doable for them. So thus the weight loss won't, transpire. So I try to get that background as to where are you at, what do you do, and what are you willing to do. And then try to set them on some type of modification diet, which would be either modified paleo or modified keto, that would be plausible for them to do. What I may do, what you may do, may not be something the patient would do. And then look at other metabolic laboratories, increased insulin, some of the things that may be pushing them or making it more difficult to lose the weight. And one of them, as we know, is thyroid metabolism. So I try to approach it from a multiple aspect.
Well, we know there's one thing that doesn't work, whether they want to do it or not, and that's the standard American diet, the SAD diet. And that's very clearly been proven through research to be associated with all kinds of medical problems and illnesses and probably everything that's wrong with us, So if that's the way they think they got to eat, we got to figure out a way to persuade them not to eat like that, because that's just not going to work no matter what pathway you take, whether that's where they are or not. They can't have it. It causes inflammation, it causes cardiac disease, it causes cognitive decline, you name it. Cardiovascular disease, osteoporosis, everything that's wrong with us that's based on inflammation, cancer. We just can't eat like that. And, we got to, probably anything they pick other than that is going to be helpful. I personally like a Mediterranean type diet. And it's been shown through research that that's probably more beneficial than any other kind of diet, particularly for cognitive and heart. I mean, it's been researched.
I agree. I do like that.
So, tell me, what are your passions or your feelings about medicine going forward? What's the future of medicine, do you think? The way that we do it, because is sort of two different sects, if you will. There's the allopathic medicine. There's the guys in the tertiary institution, which I used to be. I'm an alma mater from UCLA. I was a professor there, and I'm certainly not against that. I never have been against Western medicine. I think it's all part of the same thing. But how do we get everybody to play together in the same game? You're good at this organizing with governmental institutions. You're like in a perfect placement where you could, push on that.
Yeah, and that's a great question. It's got a couple multifaceted answers to it. My feeling is, unfortunately, since health insurance plays such a big role in the care, that health insurance isn't that happy on providing, as you know, integration of care. They want a diagnosis, they want a medication or imaging, and that's about as far as it's going to go. The unfortunate part is it doesn't really bring us to where we need to be in terms of keeping the population healthy.
Yeah. So how do we convince the healthcare system, the insurance companies, that if they keep their patients healthy, we got to get some kind of system where they get paid for keeping patients healthy, not paid for keeping patients sick?
I think the only way that will work is if more insurance companies will have a part of the policy that will allow the patient to go see integrative medical people such as yourself, such as me, that will provide some type of compensation and the patient being able to buy into that type of policy. It'd be nice to redo policies, but I don't see that happening.
Well, some of them have these health savings accounts where they can spend it on whatever they want, and some of them are advanced enough that they're not common, but actually have integrative as part of their policy. If it's referred by a physician, well, I'm a physician, so I could do that. If I can refer them to you, or I can refer them to a chiropractor, they'll pay for it. Where before, like when I came up in medical school, chiropractors were quacks, 100 across the board, but at least we're seeing some of these types of changes. So I look at that as encouraging.
I concur. There are some of the health savings plans. It's interesting to see that are basically almost set up in a visa capacity that cover acupuncture. Some of them are even advanced enough to cover nutraceutical botanicals. So I do see those. Unfortunately, I don't see those that often.
Yeah, we get those, and then we have to write out a prescription for every herb they're on, which is fine. I don't mind doing it, but I'm just happy that it's happening to some degree,
Yeah. It can be sometimes on the paperwork and a little bit lengthy.
Yeah. But paperwork is lengthy anyway. I worked for the VA, and, but even now because I have to code it, I still have to code it, and I still have to justify it, whatever, the diagnosis is. But it's like finding a right-sized peg for the hole, because the diagnoses that we use, they don't use. So when we have leaky gut, they're like, what's leaky gut? So then we have to put, abdominal bloating or diarrhea or constipation or some other thing that they like in order to get our things done, but it's.
Exactly. Yeah, you have to code it ICD-10 code with, irritable bowel syndrome, diarrhea / constipation. You have a lot of coding to do for it to go through. because you're right, they don't have leaky gut syndrome. They do have SIBO now, but
Yeah,
really
barely. Yeah.
really.
Yeah. But it's a continuum, isn't it? I mean, the gut things are, they start out with maybe a little leaky gut, and then if the diet continues to be bad, then it might go into something more inflammatory, or it might go to SIBO, or it might go to, C. difficile colitis, or a lot of things, but it's like those things are not really what it is.
Yeah. Sometimes, as clinically, as you've probably seen too, you get try to draw back in time for 5-10 years ago before this symptom of gut etiology happened, and you say, hey, did you happen to travel? Do you remember a bad food poisoning?
Right, exactly.
Yeah, any of those things, and then there are some ancillary tests you can run, and then there's some paid by insurance, but you might see blastocystis, which is one of the disease pathologies that someone may have gotten from going to India, Mexico, wherever. They may have had that for years, and eventually the body just says, enough's enough.
Mm-hmm.
So it's important to work with trying to find that causational factor that caused the gut to go bad.
Yeah, I think that everyone should come through the door should probably get a stool test, and not just one to the hospital, because those are not sufficient, but more a DNA or an RNA type stool test, where you can really see what's in there and what's not in there.
Oh, absolutely. I mean, there's so many. There's a couple companies, as you clinically have dealt with too, that tend to do a fairly good job of figuring out flora, that figure out candidal infections and other items. So they're good tests and not all that expensive, and they do provide us a lot of knowledge.
Mm-hmm. I agree. Yeah, I love that. So, do you work much with mental illness?
Mostly what will come in are, for example, there will be that we see the most common are depression and anxiety.
Mm-hmm.
Combination of both. I don't see that many patients coming in with severe psychological pathologies, but more of the common run of the mill that will come in with either depression, anxiety, or both.
Yeah, that's what usually comes to us too. And what do you do with them?
I look at a couple of things. Say it's depression. I try to ascertain what is currently going on with the patient in their life. Obviously, it's discussions based medically and psychologically, but I try to get a glimpse as to what's going on, when did it happen, how long have you been dealing with it. Then I'll try to look at, if I can, get a lab, at least some basic laboratory serologies, to look if there's some type of anemias, as we know, can cause fatigue and depression, cognitive issues. So I'll try to look at those too, endocrine too, and then try to discern which is the best way to utilize a modality, whether it be a nutraceutical botanical, such as SAMI, St. John's, really boosting up the essential fatty acid levels. There are some good studies done on 6 to 7 grams of EFA can be,
How do you do that through it?
We'll do it basically. You mean dose wise? How we get that?
No, I mean, how do you supplement that? Do you give them like
we use, every patient gets a healthcare plan.
But how do you give the EFA is my
Oh,
question.
EFA, I usually try to get in gel caps.
Oh, okay.
Yeah, I try to get the
So you're
one.
not talking about fish oil.
Yeah, fish oils.
Oh,
Primary.
okay.
Yeah, the omega.
There's a great new, actually where you are, they're growing this algae-based omega. It's called iwi, IWI. And with the pressure that we have on the oceans right now, I'm trying that out. I'll let you know.
Yeah, please do. And then try to treat it in that method. Occasionally, what I have found helpful is you can have either the compound pharmacist or you can have the patient do it, is if you need a super, super low dose of a SSRI, let's say we'll take one, a common one, let's take Lexapro.
Mm-hmm.
You can microdose that to, let's say, 1 milligram versus 10. And it's interesting, you'll get, sometimes you'll get a very interesting physiological response. The person feels better. They may be more tolerant of the medication and be more compliant of it. And then I try to use some of the local therapists,
Mm-hmm.
social workers, therapists, or PhD psychologists, or a lot of times, sometimes we need to refer to psychiatry. But trying those methodologies first to see if we can get where we need to go.
Sounds good. Sounds good. So, Bruce, just first of all, I want you to tell my guests how they can get a hold of you. And then I want you to leave them with some nuggets of truth from you, Dr. Sadlick's health truth nuggets.
Dr. Sadlick's clinical pearls, I guess. The easiest way to reach me is Dr. Sadlick. And we have the website you can go on to get, or you can, we're in Tucson, Arizona, northwest area town. And the last name is Sadilek. And you can also telephone, which is 520-297-9664.
Can they find your newsletter on your website?
The newsletter is on the website also.
Cool.
And we do have quite a bit of information on the website that could be helpful for patients. The clinical pearls I would leave with would be always, I'd like to look at it, if you have a medical problem that's going on, whether it be GI, cardiovascular, get some really quick background if you can on your genetics. Are you predisposed to these areas? And if you're still healthy, try to work around those areas so those SNPs and those genetics don't come into play. The other would be look upstream a little bit. How did you get here? What seemed to cause you to be in this current situation? And how long have you had it? What's your sleep like? What's your exercise level like? Are you doing all of the practical things for yourself? Interesting Mayo Clinic study, you probably saw too, came out, is if you can take a day and have 20% of it doing something that you like, sort of bliss, your general health, mental health, and physical health will greatly improve.
Yeah.
So look for those things that you may be missing, that you can go a little bit upstream and start turfing through.
What do you do for your bliss?
I tend to, I love doing photography, so I like doing outdoor photography. Bicycle riding is one of the things I like to do. Used to do quite a bit of martial arts, and spending time with my dog, taking her for meditative walks, and like my classical music.
Great. I'm a martial artist also, actually, but these days I ride my horse and do other sports like Pilates and weightlifting, and uh, but my time with my horse is my bliss for sure.
Yeah. They can teach us a lot.
Well, thank you so much for coming on. I really appreciate you and your knowledge and expertise and experience. And I just appreciate you taking the time for us.
Thank you for inviting me. I enjoyed this time.
Okay. We'll talk soon. Okay.
Take care.
Okay. Bye. I'm Dr. Gail Randall, creator and host of Soul Stories. I just want to thank you for listening to my podcast. I recently got a notification from the International Podcast People, and I was astounded that so many countries are listening to my podcast in the category of alternative health. So thank you, and please continue to listen. I especially want to thank Egypt, Croatia, Japan, and Switzerland, also France and Ireland, because my numbers were quite high there. So keep up the good work and check out my Instagram at Dr. Gail Randall, and particularly check out my Instagram TV, where you can hear me talking about alternative medicine subjects and also see me. It's a very good show, and I think you'll like the subjects. It's on 6 p.m. Pacific Standard Time every Friday, but it's recorded there, so you can find it there anytime you look. Okay, thanks again. I love you guys. This is Dr. Gail Randall from Soul Stories, and author of Soul Doctoring, Heal Yourself, Heal the Planet. I want to thank Saltology, our sponsor, at bathsalt.com, which fits perfectly into my medicine bag as it, like me, calls upon the ancient wisdom and modern technology to heal, especially with the stresses and ills of our modern times. The Bokak brand uses organic salts combined with organic essential oils sourced from ancient Egypt to provide a perfect remedy for your bathing ritual and healing from modern stresses. The Relief RX brand is a unique one-of-a-kind healing salt that uses organic CBD, treated with a unique emulsification process to create nanoparticles which easily enter the skin to most effectively heal and relieve aching muscles and joints. Whether from chronic inflammation or just a rough workout, this is the perfect healing bath, especially when you add the organic essential oils of neroli, lavender, eucalyptus, or grapefruit. Your body, mind, and soul will be lifted and soothed like never before. Go now to bathsalt.com. I also want to give special thanks to Larry Antonino and Agora Borealis Recording Studio for music and score, and also to closetotheearth.com for IT and computer assistance.